Hey, Dave Butler here from Align Therapy. I wanted to talk today about the association between spinal flexibility and bracing outcomes. There was a cool study, well, I guess just a study that came out in 2023, December of 2023, that looked at the association between spinal flexibility and bracing outcomes and looked at how those x-rays are taken to see what spinal flexibility there is. So bracing is something that we see a lot here at Align Therapy for treatment of scoliosis. And bracing is effective. It's been shown to be effective in the research as long as it's done correctly. And a big piece of that is how much pressure can they put with the brace, and an aspect of that a lot of times we don't think as much about is spinal flexibility. So this research article, it's titled Associations Between Spinal Flexibility and Bracing Outcomes in Adolescent Idiopathic Scoliosis, a literature review. So they looked at the literature to see what association there is between spinal flexibility and bracing outcomes. So they went through a lot of different articles and things like that, but I don't want to really get into that as much. I want to talk about the conclusion that they came to, and I'll put the link for the study in the description below, so check that out. But their conclusion was that supine radiography was the most prevalent method to look at spinal flexibility. Not as much what I wanted to talk about today, but the last sentence, spinal flexibility was strongly correlated with the in-brace Cobb angle or correction rate, and moderate evidence supported that spinal flexibility could predict bracing outcomes. That's the important part I wanted to talk about. Spinal flexibility is measured by different ways of doing x-rays to see how flexible the spine is. But the key takeaway is that spinal flexibility can predict bracing outcomes. So let me show you why that is. So here we have a spine. Let's say we put a scoliosis curve in this spine. Okay, so a right thoracic curve. Here is a brace. This is a WCR brace, a Wood-Regal-Chenot brace. Let's say we put that person inside of the brace. Now you can't see the spine very well, but if we picture having that spine on the brace like that, that brace on the spine like this, and what it's trying to do, it's trying to take that right thoracic curve and it's trying to push with force to bring that curve back to midline. So that's the in-brace correction. That's why when you have a brace made, you have an out-of-brace x-ray and you have an in-brace x-ray. The in-brace x-ray is to see how much correction we're getting from the brace. And we want to see at least 50% correction ideally in a daytime brace. With a nighttime brace, we want more than that. So if the spine has more mobility, then the brace, that pressure, can create more of a correction. If the spine is very stiff and tight, then that same amount of force isn't going to have as good of an in-brace correction. And I think that's a key point to know. Like this study said, it could predict bracing outcomes. If we look at spinal mobility and flexibility, we can predict whether bracing is going to be effective for that child. I bring this up because, well, two reasons. One, I check for spinal mobility and flexibility by pushing on someone's spine, having them move, watching how stiff they are and how much they can move and bend. And I do that because I want to see how well they can get into corrective positions with the Schroth Method and other scoliosis methods. I think that's important to identify those kids that are really tight and have stiffness in the spine, because we need to work harder at getting that mobility. I also think if we identify those ones that have more stiffness in their spine and that we're not going to get as good of an in-brace correction, we should work on that flexibility. I don't think, there's some innate tension and tightness that's associated with our spines that we can't change. Our tissue quality, how much elasticity it has, things like that. But I do feel like we can increase spinal mobility with stretching exercise, Schroth Method exercises, breathing techniques, and things like that. So if someone's being braced, especially if they have a stiff curve, they should definitely be doing flexibility exercises so that that right thoracic curve has more of a chance of coming back into midline when they're being braced. I feel strongly about that. I think flexibility and manual therapy and stretching is really helpful, but it has to be directed in the right way. We don't want to increase mobility going into the curve. We want to increase mobility pulling out of the curve. And so we have to direct that flexibility based on what their curve type is and where their curve is, without sacrificing the correction of the pelvis or something else. So we don't want to compensate with other areas. We want to get the mobility right at the spine so that when we take that brace and we put it on the spine, that it's pushing the spine in a better position and that we get a good in-brace correction. Because that's the predictive nature, that's the metric that is most predictive of brace success is in-brace correction. If we don't get a good in-brace correction, we're not going to get the growth modulation or the changes as the child continues to grow. We're not going to have the result that we want if we don't have that good in-brace correction. And spinal flexibility is a key point to getting a good in-brace correction. So we'll do some videos based on how to increase spinal flexibility and how to increase that mobility. Also how to test for it, because it's something that when I feel someone's back that has really a lot of stiffness, first in my mind is we need more mobility. Not just for bracing, but also with Schroth Method exercises. So be thinking about that if you're a therapist treating a scoliosis patient. How do we increase this mobility and give them the best chance of having a good correction, whether that's in brace or out of brace? And if you're an orthotist or you're a patient or whoever, keep that spinal flexibility in mind. If we're going to brace, we might as well brace the most effective, and we might as well help the postural correction and the scoliosis in brace correction as much as we can. So that's it from me. Hopefully this makes sense, and hopefully this helps you to see why we need spinal flexibility and the benefits of that, rather than waiting until they get to surgery. And even in surgery, we need spinal flexibility as well. We get a better correction in surgical correction when we have spinal flexibility, so it's important. Thanks for watching. We'll do more research reviews and things like that, so don't forget to subscribe to the channel. Leave comments below. I'd love to hear your comments and if you're noticing good ways to increase spinal flexibility. So thanks for watching, and we'll see you next time.